Hello friends, in this video we will talk about suboccipital triangle. So we'll see the introduction, suboccipital triangle and applied aspect. So introduction. So this is suboccipital. Occipital is what? The posterior side, that is occipital. So it will be present in the posterior side of the neck. Okay. Let's see the boundaries and contents of the suboccipital triangle. Okay. Now you can see this superomedial, floor, roof, superolateral, inferior. What we can see? So you can see roof is formed by the semispinalis and the splenius capitis. Okay. And the floor is formed by a membrane, atlanto-occipital membrane. Okay. And inferior we have the vertebral artery. Can see this vertebral artery. Okay. Along with that we have the obliquus capitis inferior. Remember, two obliquus capitis muscles, superior, inferior. Superior part in superolateral, inferior part in the inferior. Okay. Along with the great occipital nerve. And same way we have rectus capitis posterior major and minor. Here we have the minor, here the major. This is superomedial. Okay. And superolateral we can see the suboccipital nerve. Okay. The dorsal ramus of the C1 which is written. Okay. So these are the boundaries and contents of the suboccipital triangle. Okay. Let us see applied aspect. We have the cisternal puncture. So when the CSF release fails from lumbar puncture is to take out CSF. If it is not happening, we have to do this cisternal puncture. Needle introduced 2 cm above axis vertebra, pierces atlanto-occipital membrane. So axis vertebra is there here. Okay, yeah, here. So just 2 cm above. This is at axis vertebra, just 2 cm above. We have to do this cisternal puncture. We should be very careful because 1 inch above is medulla. Damage to medulla is fatal. Why? Because respiratory center is very close to there. Just 1 inch above we have the medulla. Close to that we have the respiratory center, thirst center, everything. Especially if there is damage to respiratory center, really bad consequences. So please take care that 1 inch above medulla is there. If that medulla is lesioned, it is very fatal. Okay. Remember, when lumbar puncture fails, you will do cisternal puncture. Just 2 cm above axis vertebra where the membrane is there. That's where the needle should go. The atlanto-occipital membrane, that is where. Okay. And we should take care because lesion to medulla is very serious and fatal. So, references from where I took the pictures. So that brings us to end of the video. Thank you so much. I'll see you in the next video.